My name is Sarah Manwiller, and I help patients who have hip pain so that they can find relief without drugs or surgery or injections. This speaks to their underlying desire to feel active and strong and be able to sleep and enjoy their lives again. I've been successfully treating hip pain for more than 23 years. And for this first video of a 3-step online video class, we are going to go over a stretch that will hopefully give you some instant relief. So most people do find relief right off the bat with this stretch. What we need to do first, though, is determine if or what hurts you as far as your hip pain goes. So there are several different tests we can do to determine if you have some hip compression. And typically, if you have hip pain or clicking or popping, one of these tests is going to trigger your hip pain. So the first one that we're going to do is you're going to lie down on a table or a treatment table if you have it, or you can do it on your bed. But you're going to lie down and you're going to pull the leg up of the side that hurts you, and you're going to pull that knee into your chest as far as you can. Now, typically, if you've got some hip impingement, this may compress the joint and may hurt it. You can even try bringing your knee side to side and see if that reproduces your hip pain. The other thing that you can try is, this is very indicative of hips that pop and click, is to lift and lower your hip. And you can even put your hand on top of the hip joint and see if that hip pops when you lower it. If it does, again, that indicates that there might be some impingement or irritation going on in the joint. So we're going to start with that, and then I'm going to show you the stretch that will hopefully take that discomfort away. So for this stretch, you'll want to have a pillow to kneel on because it's just kind of ouchy to kneel on one knee. But what you're going to do is kneel on, my left knee is my problematic, or my left hip is my problematic hip. So I'm going to kneel on my left knee. I'm going to tuck my toes under in the back. The other leg is out, hip and knee are bent to 90 degrees. And from here, I'm going to do what's called a posterior pelvic tilt. Now, some people know what this is, some people don't, but essentially what you're trying to do is, if you were a dog and you had a tail, you're trying to pull your tail between your legs. Another way of thinking about it is you're going to kind of flatten out the curve in your lower back. Once you're there, you're going to actually squeeze your butt cheeks together. Now, when you do this, you should feel kind of a strong, burny stretch at the front of the thigh of the leg that you're kneeling on. So once you're here, I'm going to have you actually hang out and hold this for about 60 seconds. And you can hold on to something. This is not a balance exercise, so you can hold on and you're just going to hang out here for roughly a minute. As the stretch gets a little bit easier, so it's going to give, you can kind of tuck a little bit more and squeeze your butt cheeks a little bit more, and that'll intensify the stretch. So when you're done with that, we're going to recheck to see if the tests that bothered you initially feel better. So you're going to lie back down and you're going to pull your knee into your chest, and you can kind of roll it around a little bit. 9 times out of 10, you're going to feel quite a bit better. It won't be as pinchy. And again, you can try lifting and lowering that leg to see if that feels better as well. And hopefully it does. And hopefully you'll get a lot of relief from this. Tomorrow, or you should be receiving an email from us about the second video. And in that second video, we're going to go over 3 things that you should do and 3 things that you should absolutely not do in order to enhance the healing of your hip. If you are concerned, however, about what's going on with your hip and you really feel like you need somebody to check it out, give us a call. The phone number is below the video link here, and we can get you into our office and hopefully get you evaluated and feeling better even faster. But keep an eye out for the second video, and look forward to seeing you then.